Good afternoon. I'm Elizabeth Hess. This is part 6 of meeting with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. She's been great about disseminating the word, as has Urbana Mayor Diane Marlin. I want to thank Jason Liggett. He's our producer. I'm in one location, Julie's at the health department, and Jason's in a third, and that is how we're doing business these days. Good afternoon, Julie.
Good afternoon.
Let's start with the fact that a couple of weeks ago, the federal government said that anyone who wanted to have a test could have one. Is that the case?
That is still not the case anywhere in the U.S. I mean, you can, the guidance has not changed in the fact that you need to be asymptomatic. Asymptomatic individuals are not encouraged to test at all, but anyone with symptoms, the guidance has expanded enough in Champaign-Urbana and Champaign County right now that pretty much anyone with symptoms going in through their healthcare provider will be eligible for a test.
The PPE situation, as I talk to friends throughout healthcare, doesn't seem to have solved itself. I have friends using face masks several times a day and the same gloves that they're just washing off with soap and water. Have you heard anything about PPE?
Well, I mean, we've received several shipments locally from the Strategic National Stockpile. Public Health is collecting the materials from the SNS for long-term care facilities, for homeless shelters, for places like that, congregate living facilities. The hospital, Carl's Regional Hospital, is collecting it for healthcare providers, and then Champaign County Emergency Management Agency is collecting it for first responders. So all of us have received some shipments from the Strategic National Stockpile. Certainly nothing like what we need or would request, but it is coming in, and we're looking at all possible alternatives. We're receiving all kinds of information to be able to order stuff privately. Some of those aren't panning out. It's like, it sounds good, you know, when we get it, but when we actually follow through with it, a lot of it is not actually going to materialize into what we need. So no, we do not have enough PPE for anyone yet. We have some, and certainly it's being prioritized for those direct line healthcare workers who are working with people with COVID and doing close care with them.
Right now, where do we stand at numbers in Champaign-Urbana?
Right now we have 56 cases, and we've had 17 recover, and we have 9 in the hospital at this time.
Is it up to the federal government to distribute all of the equipment we need? Is it for the governors to buy? How is this getting disseminated?
Well, I can only tell you how it was done in the past. With H1N1, for example, we received massive shipments of all the supplies and materials that we needed to do the vaccine clinics, for example, even funding to purchase our own refrigerators to expand our capacity to store them. So yeah, this is different. This is what we're seeing now is a lot of competition between different places. We're all going for the same PPE. There's no just massive shipments coming to get everybody everything that they need. And it seems like materials that now should be going into the Strategic National Stockpile are being distributed through the private market, which is making it very hard especially for smaller places to get in on the deal.
The masks have been a big part of the discussion lately. CDC guidelines now say everyone should have one in public. Does that mean while I'm out walking my dog, somebody passes me running, they're breathing on me? I mean, does that mean everywhere I go, wear a mask?
You know what? If you have them, wear them every time you're out. It's a good thing to do. Yeah, if people are running next to you, you don't want to be breathing what they're exhaling. So ideally, they would have one on as well. But if you can give somebody a wide berth and go, you know, at least 6 feet away from them, then that should be fine. But you know, if you have one and you're going grocery shopping, for example, or you're going into a pharmacy, or you're going to a healthcare provider, or anything like that, make sure that you have one on that protects the other people working there. And then hopefully they will have one on as well. And if you keep everyone from breathing out into other people's space, you're going to limit the chance that somebody would be spreading this asymptomatically.
6 feet seems to be the magic number to stay away from somebody. How did or who came up with 6 feet?
Yeah, that was done by the Centers for Disease Control and Prevention. And what that has to do is the amount that droplets tend to spread. So that's when you're talking and things can fly out of your mouth, or if you sneeze or if you cough, that's how far it typically projects. So that's where that came from.
People want this to be over, a magic cure, a medicine, a vaccine. The vaccine they're working on. Medicines are a little murkier right now. We keep hearing about a malaria drug for lupus patients that may or may not be accurate. What's your take on that?
Well, my take on it is I'm not a medical doctor, so I'm certainly not going to be telling someone how they should be treating patients. But I do know that there are studies going on all over the world, not just the United States, and they're looking at every conceivable type of drug, every combination, they're looking at, they're doing things with antibodies, with serum from people who have recovered. So there's all kinds of things going on. Nothing is really off the table, and what they're doing is being able to try things, and then they're publishing quickly. They're doing that so that other places could try to replicate or to build off of that. So we're going to see all kinds of stuff out there, but you need to understand that when you get this, if you were to be hospitalized, your healthcare provider will be up to date on what the most current research says. So, that's what I would do if I was sick with it. I would just simply listen to my healthcare provider. I would never go in general and suggest to them what treatment I should be given on anything. So certainly not this.
Julie, this is a perfect time to review what herd immunity is. We hear it all the time about flu. How does herd immunity affect COVID-19?
Well, the issue, of course, with this is it's a brand new virus to the human population. So no one had any immunity when this started. I mean, zero immunity. So what we're doing now, of course, everyone who's had it and recovered is assumed to have immunity for at least a year. I mean, they just have to study it. It's such a new virus. But until we get a safe and effective vaccine that can vaccinate the majority of the population, we're not going to have herd immunity. Herd immunity just means that there are enough people vaccinated or enough people that have immunity to prevent these widespread outbreaks. So that's what we're going for. And our overall strategy everywhere, but especially in Champaign County, because that's what I'm most familiar with, is to try to do everything we can to slow the spread of this so that our cases continue. People may still be getting infected, but keep them like this instead of like this, because when you do that, what you're doing is you're overwhelming your healthcare system. So if you keep the cases like this, everyone who needs to be hospitalized, there will be space for them. If they need an ICU and a ventilator, there will be ICU and ventilator space available. So that's the idea behind that. Our state got out way early in front of this, which makes me extremely happy. Our county has been very much on this, and the cities. So we need to keep people away from each other and to prevent this as much as possible so that we do not overwhelm our resources.
Some of the resources are typical appointments, dentists, doctor's appointments. I had to cancel x-rays coming up. Mm-hmm. Should we be rescheduling these for summer, for fall, or we really don't know at this point if we are going to have optional medicine anytime soon?
Yeah, you pretty much, it's like with anything, you can reschedule it for whenever you want, but you may end up having to reschedule it again. So the same thing, with doctor's appointments, with airline tickets, everything, they kind of give you a deadline in which to go ahead and reschedule. But the fact is, it may need to be pushed off again. It all depends on how we're doing locally.
Locally, I've heard the phrase, act like you have the virus and that everyone around you has the virus. Is that overreacting, or is that pretty much a good mindset?
That's absolutely a good mindset for this, because we know that people can transmit it asymptomatically. They might not know they have it. They might have very mild symptoms. So you need to assume that you are infectious. So don't go around anyone, because you could be infecting them. I'm very concerned about the holiday coming up. The holidays are coming up here real soon. And I am worried about that, because I think that there will be people who think that, oh, well, it's okay to see grandma on the holiday, or it's, you know, it's okay to go do this, or just one time. And it really isn't. I mean, it's something I cannot stress enough. You need to stay within your cohort. Well, we call it cohort. You will probably call it your household, or, but it can be your household if you have other people in your household too, as long as you are the group that's staying together and you are, you know, that's the group that's going to care for each other, you know, if you were to get sick or something. But it's very important to assume that you're infectious and to assume that everyone you come in contact with is infectious. That is really key.
I know the holidays are important. We have three of the most important holidays coming up in the next few weeks, but you're saying intergenerationally, we know you want to be together, but that's what this kind of thing, Zoom, is for. We cannot risk infecting old or young.
That's right. I mean, there have certainly been people who are younger who have had serious complications with this, and even deaths. So it is not something that you can take lightly. And it's not something you can say, well, we all feel fine, so we can go do this. That's anytime you leave your house, you are basically breaking quarantine. So if you yourself can maintain distance from people and not touch your face and, you know, not infect yourself, then you can assume that you're okay. But what you cannot do is let other people into your home, because you have no idea what they're doing. You also have to assume that your coworkers are also infected. And just because you're around people a lot you don't know what they're doing on the off hours. You may have very strict rules at work, but you don't know what people are doing. And we have to make sure that people know, do not congregate with your coworkers. That is certainly becoming an issue. And I want to remind people, if my staff or I call you, because you're listed as a contact, or because you are yourself infectious, or you're positive, we're going to ask you, where have you been? And, you know, I hope that you say nowhere. I've been in my home and I haven't risked infecting anyone. But if you do, then that's a lot of people that we have to follow up with, and to make sure that they are monitoring for symptoms and everything. So you really need to stay away from people. I cannot stress that enough.
Is that what tracing is called? Am I getting that right? That the Champaign-Urbana Public Health District, along with Illinois, is trying to trace the origins of who talked to whom, where?
Yeah. So if somebody is positive, public health will reach out to them. We get notified through the laboratories or through the providers. It's an immediate reportable. So we need to find out within 3 hours. Then public health, regardless of what day or night or whenever, we will start contact tracing. That means we do a very thorough interview with the person who's positive, and we try to find out where they have been, who they've been in contact with. Close contact with COVID-19 is considered someone who is within 6 feet of that person for longer than 10 minutes. So that is, you know, ideally you would have 0, except for perhaps the people that you're in your house with. But that's, you know, that's not what we're finding. There's still a lot of people who are in close contact with people. So we really need people to pay attention to this long before they are infected, and limit their contact greatly, because that's what's going to limit the spread.
Long before we had the pandemic going on, if you walked into the Champaign-Urbana Public Health District, there was a food pantry at the front. There were affordable or free dentist visits. Can you talk a little bit about what the Champaign-Urbana Public Health District is still doing right now, how many staff members you have there, and what kind of services you're still offering?
Sure. We still have all of our staff here. We are, they've been moved, a lot of them have been moved into the Emergency Operations Center. They've been moved into doing contact tracing, following up with people who are in isolation or quarantine. We still are doing communicable disease investigations, because foodborne illnesses and other outbreaks don't stop just because we're having a pandemic. So we have to keep on top of that. We have WIC. We are doing curbside appointments for WIC, so people can still get their coupons for food. We are still doing immunizations. We're still doing emergency dental for kids only. And then we're also doing, you know, STD, HIV, STD, communicable disease, and family planning as well. We have a lot there. The services have been altered a great deal to limit contact between patients and staff, but we're still basically doing everything. Of course, restaurant inspections have to continue. We've got a lot of the environmental health workers are out doing all kinds of stuff in the community, including helping places determine if they're doing a good job with social distancing and infection control practices. So everybody's still working. With the food pantry, I'm happy to say that Friends of Champaign County Food Pantry is still purchasing the food. It is still here, but we're using our own staff now to make the bags up and to do it through a drive-through. So if someone needs the food, they come through our drive-through on Thursdays from noon till 2, I believe it is, and they drive through and they get the bag of food that way rather than coming into the building. And additionally, we also put some any food that we have Monday through Friday that's not associated with the food bank, we put that out on the front landing area of the entrance so that people can come and help themselves with that as well.
I want to point out that your staff is considered essential right now, and they're doing government work. Who is taxed with putting the updates on the website and on the Facebook page, because they're doing a fantastic job?
Well, there's a really big team working on that with the public health, or not public health, I'm sorry, the public information officers. So they're public health information officers from both hospitals and from the county and from public health and from U of I and from, you know, several other agencies as well. And they're working together to get messages out. And then they're being put up on our website. Somebody actually created a nice little thing for us on there. If you notice the graphs that show the different kind of information about our cases, it's more granular data than just having, you know, plain old numbers. So that's nice. That's updated every day at 4 o'clock or around 4 o'clock. And so, you know, we also have the county also put together a really nice website that has all kinds of information on it, and that is also, we're pushing that out as well. It's got a lot of information on it.
What is your website or Facebook page if somebody wants to go to that right now?
Our Facebook page is Champaign-Urbana Public Health District, and our website is c-uphd.org. Last
words of encouragement or words of warning before we talk again next week?
Well, I'm always saying stay home, stay home, stay home, but I do have to say that a great majority of our community is doing a wonderful job. They are doing a wonderful job at staying home. Both of the mayors have put out messages. We've got, you know, the county putting out messages. We've got the U of I putting out messages. I mean, I noticed Adams billboards or Adams Outdoor Advertising, they put up billboards. I mean, people are getting the same message out there. The message is to please stay at home, please stay away from other people, and that we are all in this together. We really are, as a community and the county. And you know, we're doing a good job. Our community is doing a good job. You're still going to hear me harping about the ones who aren't, but in general, people are doing an amazing job. This is really hard. This is hard stuff. It's different stuff. But I do want to encourage, I am a little disappointed when I go out and see the stores are as packed as they are. I just want to urge people that if you do not have to be there for something, don't be there, because not only are you putting yourself at risk and your family, you're putting the workers there at risk who have to be there, and you're also putting our healthcare workers and our first responders at risk. So just, you know, those of you who are doing a great job, please continue. Those of you who could do a little better, please do a little better. And, you know, like I said, we're in this together, and it shows, and we're in a great place.
Urbana Mayor Diane Marlin, thank you for letting us get this important word out. Jason Liggett, thank you for producing this segment. But most importantly, I want to thank you, Julie Pryde, Administrator of the Champaign-Urbana Public Health District, for giving us these important warnings and encouragement. Thank you so much.
Thank you. My pleasure.
Stay safe.
You too.